make us go live, that will be good. We are live now, I believe. Good morning, everybody. Dave Stewart here, leader of the Isle of Wight Council and chair of the Health and Wellbeing Board. It's Thursday, the 28th of January, and this is the 9:30 meeting. I do apologise for the few minutes of delay, which was just to make sure all the representatives that we needed were linked in and on the call. If I could ask everybody if they could just go to mute and cameras off, it will help the process. Thank you. Substantial number of participants as shown in the minutes, and the first item on the agenda is the minutes from the last meeting in October, 15th of October. If members can just indicate in the chat box that they're happy for these to be confirmed as a true and accurate record of the minutes. And I'll ask Charlotte if she could just monitor the chat box for me, please. Also gives our members a chance to exercise their skills in using the chat box.
Chairman, it's the Chief Executive. There's no comments in the chat box.
Thank you. I'll take that members are happy then. Declarations of interest, please unmute if you have a declaration of interest that you haven't already disclosed either at a previous meeting or as part of your normal personal interests with your organisation. So I'm not hearing any, so I'll assume that's fine. Item 3 is public questions. There's normally 15 minutes, but a question can only be put if it's been delivered to the council through democratic services no later than 2 working days before the day of the meeting, which was Monday the 25th of January, the deadline. Charlotte, can you just confirm that if we have any public questions submitted within the timescale? I don't know if Charlotte can hear me.
Sorry, Chairman, it's Marie. We've not had any.
Thank you, Marie. That's fine. So we'll now go to item 4, which is the COVID-19 response and recovery. Because of the current situation where pretty well all our board members are involved in a whole range of activities, and we want to stay focused at the moment on the COVID-19 response and recovery, I've invited the members of the board to just give us a brief update, short briefing of where they see things from their perspective. Because of other commitments, I'm going to take this in a slightly different order to normal, and I'm going to begin with Norman Arnold if he's on the call, and if he's not, Chris Ashman, just to give us a brief update from the economic perspective in relation to COVID-19. I'll go to you, Chris.
Thank you, Leader. I'm actually hopefully going to provide a brief update on recovery as a whole, Leader. The board will remember at its last meeting, it kindly agreed to act as the board body providing strategic oversight for recovery.
Yes.
That being said, as we're all aware, the opportunity to consider recovery in a focused and a strategic way has been compromised by the continuing need to respond to the reinfection and the now 3rd lockdown. So the paper, which I'll table with the minutes, Leader, is a 1-page update really on the to remind the board of the intended three pillars of recovery, looking at how we recover as a community, how we recover as an economy, and how our place should recover, learning from the experiences we've all been through in this last year. So the focus around recovery in the community has been around obviously the fantastic response we've had from businesses and community to collaborate and to protect the most vulnerable. And obviously our colleagues in health focus now on rolling out the vaccination programme, sets the blueprint really for a safe and prosperous future in terms of recovering from the pandemic. That being said, all our minds are rightly focused on the current management of infection and encouraging those safe behaviours and supporting our colleagues in the health and social care system. The community recovery obviously looks at mental well-being as well, and all of the efforts in the last 6 months in particular to promote access to the sources of support available under mental well-being, and not forgetting some of our most vulnerable. A project to actually provide a sustainable solution for the homeless community on the island has got underway. And I think the story of the paper, which members will see and reflect on, is that we've been doing our best to initiate key actions that will help our recovery in the context of being held up, if you like, by the infections that have occurred. No more so has that been the case than in the economic sector, and obviously the impact on businesses being able to operate and trade, and the resulting effect that has had on unemployment, with the unprecedented increases in unemployment, particularly amongst young people over the last 12 months. So that being said, the government's national approach to supporting and addressing those have obviously been actively embraced on the island. And the council was successful to be appointed as an approved Kickstart provider, and will shortly be advertising 44 vacancies for colleagues, primarily in the health and social care part of the council, to help deal with the recovery issues associated with the pandemic. There's obviously been a continuing programme of business grants as well, and we just on a lockdown, this lockdown, just paid out £2 million to businesses to help them survive this winter period during this lockdown agenda. And I think if Norman was on the call, he would reflect, I think, on the fact that pre-pandemic, the Economic Board was heading towards encouraging an economy which was focused on making the best of our natural assets and focusing on a green economy, and also the full fibre rollout, which of course has now evidenced its value in no uncertain terms as far as helping us manage the pandemic is concerned, and really will be the foundation stone for our future vision for the island as the best connected island in the world. So that direction of travel hasn't changed because of the pandemic. If anything, it has become more reinforced as a vision. Our natural assets and the quality of our well-being and living offer is highly attractive, and the opportunity afforded by digital connectivity has never been more important than as we're experiencing now in using platforms for this meeting. So on Place Recovery Leader, I could go on for another 10 minutes in terms of the different projects we brought forward, but I think it's probably best there I pause and take any comments from members of the board and any key recommendations going forward.
Thank you very much, Chris, and thank you for reflecting some key points there, particularly around the Kickstart opportunity and the £2 million from government to support island businesses at this really difficult time. That's really key elements. I'll just, from the chat line, I'm just checking to see if there's any comments which you want to add. Just for information, Michael Lilly's highlighted that Ryde Town Council have been approved a gateway provider and got 42 placements rolling out in the Ryde area. So that's more positive news from the economic challenge that we're going to face and will probably be with us for some time. Simon Bryant, did you want to speak? And then I see Norman Arnold is on the call. In relation to this aspect, Simon.
Yeah, many thanks, Leader. I just want to say thanks to Chris, but also I think as this board's overseeing the health and well-being of the island population, we're going to need to really rethink carefully in the right time to review our joint strategic needs assessment. As Chris has outlined, some of the mental health aspects have been picked up, but we'll need to think about some of the other aspects. We know that things like long COVID, are now a condition we need to understand better, and what the impact on the health of the population, which of course links to recovery, but I think we just need to really work that together so that actually we can work with Chris to help them understand the health of the population that will impact on recovery.
Thank you for that, Simon. You've just ticked off an important point I wanted to make. At our ICP, our Integrated Care Partnership meeting, the very point that you've raised was highlighted. This is about the impact of and the impact on mental health in relation to COVID, and as you say, Chris, even the wider economic position. And I know we're going to be planning a strategic response to this for the island, and there will be meetings arranged very soon to consider how we support our community with that particular aspect, because I think the long consequence is going to be something we have to include in all of our approach. So thank you, Chris. Norman Arnold, I see you've come on the call. Unfortunately, I don't know if you heard Chris's briefing or not.
I did. Basically,
Do you want to add?
Yes, please, if I may, Leader. Talking about this and thinking about this over the recent months, it's vital that we recognise the essential role that the economy plays in sustaining our health and well-being, both physical and mental. The Islands Economic Development Board, we've really had this at the core of what we've been about for the last few years. I think pre-COVID, do you remember that? That was last January.
Yeah, I know.
Our aims, we're moving towards, as Chris has just touched on, the full digital rollout, which we're supporting, quality environment initiatives, things like the biosphere, high quality towns, doing something with the high street, so the high street action zones that we put in, looking at wage levels and competitiveness, both from the point of view of our businesses and also employees on the island, and actually creating an environment that encouraged new businesses, new ideas to flourish here, actually both for young people and, should we say, those who serve of more mature years. So there's a brilliant over 50 scheme that we've been supporting, the Chamber are running, and also for younger people we've been looking at things that Island Opportunities have been running there. But my question for all of you today is really, we've also done a lot of work on place and place marketing for the island to make it, as Chris just touched on, a place that people would want to live and work, get ourselves up the league table, as it were. And so what we're really looking for from all of you would be some input, please, into what you think our strongest card is. You know, what are the things that you really think we should be pushing forward and celebrating as our strengths as an island?
Okay.
It's been a long, and that I think that's something that I probably want people to go away and have a think and come back to Chris and I. But
yeah, what I've done, Norm, I've noted that as an action from today, because you've asked the question, and I'll apologise now for cutting you short, because I'm very aware that we've got another member who's got to go as well, and I know you've got a board to chair in 10 minutes time.
Right.
So I'll move swiftly over to Steve Crocker. Steve is the Director of Education, and probably can give us a brief island focus on the latest school situation. And if there's any questions, I know we've got Paul Brading on the call as well. Steve.
Thank you, Leader. So just to briefly update colleagues on where we're up to, which has obviously received some more clarity since the Prime Minister's announcement last night, which said that the ambition is for schools to reopen on the 8th of March, and a good deal of preparation will take place between now and then. But currently, schools are open for children of critical workers and vulnerable children, and it's important that that message is heard and understood, because they are open and they are receiving significant numbers of children. I'll talk about the numbers in a second. Also, the early years provision on the island is open for all young children, and that's being used by many parents. There are ongoing infections that are passed into schools, and we receive not as many as perhaps was in the autumn term, but we still receive a trickle of information about people needing to self-isolate, but the impact is less because there are fewer children in school. Just to give you some sense of the numbers on that, generally in the primary sector, we have about 20% of our children are attending school, a mix of those generally between who are open to children's services, in other words, have a social worker, or who have special needs, and children of critical workers. That's about 20% in the primary sector. And that is very similar to the national average. In fact, it's almost exactly bang on the national average. And similarly, in the secondary sector, the number is pretty low. It's 4%, both nationally and on the island. Again, we're bang on the national average. And again, there's that mixture of children with a social worker and children with special needs. Part of that story, though, is about the improvement in the way that schools have been able to get to online teaching. So particularly in the secondary sector, I think parents are increasingly aware and see what schools are doing in terms of online education, and children are being taught that way and are keeping up in as much as we can. I don't think anybody is going to pretend or make a case for online teaching being as good as classroom teaching. That's not what that's about. It's about trying to maintain something until we get back to school. Finally, just on a couple of points on children's social care. With the services there for the most vulnerable children on the island are standing up well. We're visiting children where there is evident risk, and that's in person. And we're also seeing other children through other means to support them and support their families through online means as well, and risk assessing that. But we're actually seeing all of the children on a sort of rotation basis. And the final thing I would want to say, which sort of I'm duty bound to, and quite rightly in my role as Director of Children's Services, is that we and it picks up on your comments earlier, actually, Leader, but we need to recognise that the long-term impacts of the pandemic on children and young people, and it's obviously had a very tragic impact on elderly and vulnerable people. But there is a longer term impact upon the emotional, social and educational development of our children and young people, which will be felt for many years to come. And I think that was acknowledged, interestingly, yesterday by the Prime Minister. He talked about a 4-year recovery programme, and that's the sort of timeline that I had in my own head. And in the meantime, some of those the impacts that we are seeing in various ways are pretty severe for families, and particularly the poorest and most vulnerable families in our communities.
Steve, thank you for that. I think just in that last comment, you've exposed a line of activity that we should now pursue, and I saw Paul Brading's picking this up, and we should take that forward as part of our next 4-year strategy. You're absolutely right. The impact, physical and mental health on children on the island, and if you think about, as you well know, top 10% of the most deprived children in the country, we are one of those areas which has got an area of the island in that. So I think your point is extremely well made. I'm also grateful for you giving us a picture for the island, because the public listening will at least know that we're aware of the situation and action is happening. So thank you for that.
Yeah. Sorry, can I just, one thing I forgot to mention, which was our Connect for Communities programme, which is our grants programme, making sure that children have got free school meals over holiday periods, and that there is still a range of grants for voluntary sector organisations to support families in the community during the winter period as well. So I beg your pardon, I forgot to mention that, but it's important.
That's absolutely fine. I see one question of clarification in the chat box, which is around whether children on the island have access to laptops and internet. And obviously you've got schools programs running, as we know, with Bernardo's, CAMS, etc. But the internet, laptops, can you add any information on that?
Yep, there are, I can certainly get the numbers back out to people in due course, but because it changes every day, but we've all schools that need laptops have ordered them. If they're a maintained school, we coordinate that. If they're an academy, they order direct from the DFE. So we don't have a full handle on exactly how many are due. Roughly speaking, at the beginning of January, most schools had about 3/4 of the laptops that they'd ordered, but because of the subsequent lockdown, a number of schools then ordered a lot more, and they're still waiting for those to come through. So I can get the correct numbers. I wouldn't want to be misquoted in public, but essentially it's work in progress.
Yeah, no, that's a question from Michael Lilly. Thank you, Michael, for that question. Steve, thank you very much. I know you've also got to go on now, like everybody's. Time is precious at the moment, but I think I'm very grateful. We've got Paul Brading on the call if anything else arises. So thank you to Steve. Can I now go to Simon from the public health perspective, our Director of Public Health?
Chairman, apologies, it's the Chief Executive. I think Councillor Brading has a brief comment he wanted to make. Just
I'm sorry, I missed that. Paul, do you want to come in?
Yeah, good morning, Leader. I'm grateful to Steve for his comprehensive update, and obviously, it's great news. Just a couple of things I wanted to add. Just a bit of clarity on the primary. 20% of pupils in school sounds a lot. You cannot compare lockdown 1 with lockdown 3. The lockdown 1, we were around about 4.5–5% of primary children in school. It is much higher, mainly because the criteria around key worker children has changed completely this time. It's a different set of criteria. So, I don't want anyone to go, compare the two together. And when, laptops in schools, I'm grateful to the private sector coming up with laptops as well as the government. But it's not only laptops, we're also supplying, like schools are supplying dongles, extra data to people to use, paying for extra data on a temporary basis. So it's the whole IT provision around, what we're providing for children. And the final point, just briefly, is mental health is a key part going forward. Prior to this latest lockdown, we were successful in a bid to put together 2 mental health teams on the island, one secondary, one primary. They are starting now with the training going into it. So we will have extra mental health provision, and good news, it ties up with what the situation we're now facing. So there's lots of positives in those directions going forward. Thank you.
Thank you, Paul. And I've just made a note there that we need to make sure we include schools in our mental health recovery strategy. So that's really useful. Thank you very much for that. Okay, Simon, are you available now? Simon Bryan?
Good morning, everybody. We're all well versed in kind of what's going on in the pandemic, so I'll give a quick update on the data aspect. Some of my information will then flow into what the NHS colleagues have said, but I'll just give my perspective and then let them come in. So if I start nationally, we have seen the rates of COVID drop across the country, which is really positive. There are some areas around the country that still have rates of over 1,000 per 100,000, but in the main the rates are coming down. I think we just need to be mindful of that. In the main, they're coming down. For the island, they are falling, but as I said, that's not the case everywhere, so we need to be mindful of that. So our current 7-day rate, that's the rate in the last 7 days, is 415 per 100,000, and that's last week we had 589 new cases. It's worth saying at the peak we had one day we had nearly 400 cases, and we've seen that fall and fall steadily. However, it may be starting to fall more slowly, and we've seen that in other areas of the country. So we need to be really mindful of how that's falling. We also know our over 60s rate, which was high, is now at 545 per 100,000, and again that's falling, so that's really good news. And we know that the over 60s rate particularly impacts on hospital activity and care, so we're really mindful of that and how that affects both the NHS Trust and primary care. And then if we look at our positivity rate, so that's the number of people who are testing, who test positive, that's 12.3. That's still quite a high positivity, one that under 5%, but again that is falling. So with regard to all of that, we are in a really positive position with regard to the virus. However, we mustn't be complacent, and what we want to make sure is that those rates continue to fall, with people staying at home as per the lockdown guidance, or if they're going to have to go out for essential reasons, whether that's work or essential shopping, that they manage social distancing, hand hygiene, and wearing a face cover where required. If I kind of speak in generalities, and then I'm sure Maggie and others will comment, what we have seen is, as we see the rate of infection fall, we will start to see the rate of hospitalisation fall, but also we know that, and this, if I'm talking generalities rather than specifics, then we see a fall in critical care, and then sadly the last thing we see to fall is deaths. So we're still seeing an increase in deaths, and we are likely to see that for another couple of weeks because of the way this virus works, and we need to think about that. It's worth saying what we've seen in this recent time period, this new virus and the new new variant of the virus, which spread so much faster. So if there's any lapse in any of those measures that we've talked about, we will see that virus spread, and that's what we saw spread through the island in early January.
Simon, John, could you mute, please?
Thank you.
Did you hear me,
Apologies,
John?
Chairman. Yeah, apologies.
That's all right. I didn't want you to say something you didn't want in the public domain. Simon, sorry.
Not at all. With that regard, we need to be really mindful. As I say, we're in a very positive position, but I know that the NHS is under huge strain, but I'm not going to tread on someone else's toes. They can talk about that. So as I say, with regard to the data, we've seen that fall, but we need to be mindful that that's because of the good work Ireland residents are doing. And I know it's hard, and I really thank them from a public health perspective for all they're doing, because with that action, we are seeing those rates fall. Thank you very much, Leader.
Simon, well, first of all, can I just say thank you to you? I know you are flying on literally without travelling all over the place, but you definitely are keeping the Isle of Wight fully informed and doing your role. And so on behalf of the island, I say thank you to that. And I'm going to go straight to Maggie, because it's a nice follow on from where you are. And Maggie's already given the board some briefing on some of the situation, but I'm sure she wouldn't mind just the opportunity to cover some key aspects. So Maggie, if you're next, if that's okay.
Thanks, Dave, and thanks again to Simon. It's always good to hear from public health colleagues at this time. I think while Simon's more optimistic, I think, than how I feel at the moment, it's really pleasing for us all to recognise the prevalence are coming down in the way that Simon's described. I think, sadly for me, I still feel that we are in the eye of the storm at the moment. So I would urge any member of the public and all board members here today to not get complacent, because it is pleasing those numbers are on the way down. But I can tell you that as it is today, the Isle of Wight NHS Trust, and particularly its acute and community and ambulance services, are under considerable strain. Our mental health colleagues also, and I think some of this has been alluded to already in this conversation, are pushed to some of the very limits of the services that we provide. So we continue at the moment to be seeing very high levels of patients needing our care from an acute perspective, and that also transcends into the community. If you think about this as a wave, we're seeing a large amount of patients in hospital with their needs associated with COVID, and that bulge of patients at some point will pass into the community. And I mean community in its broadest sense, not only my services in the community, but also that of primary care colleagues and also of social care colleagues as well. So we're far from in a position of starting to feel that we've seen the worst of this. My intensive care unit is still working at 50% more capacity than what we actually are commissioned normally to provide. So it's still a very concerning position for us. One of our greatest challenge, and I know you'll hear this from other colleagues as well this morning, remains staffing. So we have got around about 10% of our staff off sick at the moment, off sick or with isolation as a result of being in close contact with positive COVID people. So we've got a very high level of sickness. That has been extremely high in our ambulance service. It peaked at about 20%, actually just over 20%. So there's a considerable strain, not only on some very sick people requiring our care, but also on the fact that our workforce is quite depleted as well. We've heard, I think, particular emphasis when we talked about children's services on the mental health demands of or mental health impact of COVID. And it's very interesting when we start, I think Simon mentioned the effects of long COVID as well. Some uncharted territory for us, both from acute and primary care, to be focused on as we move into the recovery. Of course, I think everyone's aware in this board meeting today that in order to cope with the surging demand of acutely unwell patients, we have had to do what other parts of the country has done and step down some of our more routine care. Now, I always say in these circumstances, routine care might make it sound as if it's easy to step down. But actually, if you're waiting for a new hip or a new knee, or you're waiting for other life-changing surgery, then the impact of COVID is greatly affecting your quality of life. So we're very conscious that we've had to do that. We are maintaining cancer services, and we are maintaining our emergency services. but with tremendous strain on all elements of what we do. I will pause there, Dave, because I did circulate a few slides yesterday. I'm more than happy to take questions, and I'm also more than happy outside of the meeting if any members want to drop me a line or have a conversation about any specific areas that they want to focus on. I'm more than happy to find time to talk to them.
Thank you, Maggie. I've got one question, which is, and while you're thinking about it, is just, I don't know if you have any observations want to make about the military support. And while you're thinking about that, can I again just thank you tremendously on behalf of everybody for what I call the hospital team are doing. Everybody in there. It's another area where I think we've been very fortunate at this time to have people who can step up to the plate. I'm sure you'd say that. And I've made a note here, another action is to think about the need for recuperation of staff and people when the time is right, because you absolutely highlight the strain that everybody's under. So thank you. Just on the military question, if you've got any comments.
Yeah, thanks, Dave. We're very pleased to be able to welcome some military colleagues earlier this week, supporting us across the breadth of our services. I was particularly pleased that they've been able to help us with a piece of work that we've wanted to have extra resources to look at, and that is around the amount of oxygen that's available to us. It's quite technical, won't go into all the details now, but having the logistics that they've been able to bring is helping enormously with that. We're also continuing to look at where we can deploy them to get the very best support for our services, and that is a dynamic situation because, as I've said, we're having to react to large levels of staff sickness.
Good. Well, that's really good news as well. Michael Lilly, who's also wanted me to pass on his thoughts about the amazing work staff are doing, who's just inquiring whether COVID recovery patients coming back into the community, and is there anything from your perspective, and obviously we've got somebody on from the voluntary sector, it would be Michael, anything more the voluntary sector could do to help? I mean, I know they're doing a mountain of work already, but you may have some views on that.
I think at the moment, Dave, what we're trying to do is work together as a system to ensure that we're using all of our resources appropriately. Myself, Alison and John, we catch up every morning, and we've had a session this morning. We're trying to look at where to deploy our staff, including the voluntary sector too. And again, because of it's like you put your finger in one hole and the water stops leaking through, and then you find another 4. Yeah. So we are talking constantly about where are the best places to deploy our staff to. And I think really what I would say is the fact that our voluntary sector colleagues are prepared to work in a very dynamic way to support us is very much appreciated, and we'll continue. And I was very pleased that we've been able to offer the vaccination to some of our voluntary colleagues as well, in recognition of the amount of support that they're giving us to keep the NHS services running. So nothing specific that's springing to my mind right now on the call, but we are in constant dialogue with voluntary sector colleagues.
Thanks. That little anecdote about trying to plug the holes, interesting. I come to the Dunkirk syndrome in my head. You know, everybody's trying to get safely away from the bad stuff, and it is a bit of plugging the holes until we can get everybody safely away. So I really like that. Thank you for that. Really appreciate that, Maggie. Can I move on now to Michelle, who's going to speak on behalf of the CCG, who, particularly for members of the public listening, have the overall responsibility and oversight for the vaccination programme, and I'm sure Michelle will share with us whatever she can. Over to you, Michelle.
Thank you, Dave. Firstly, I'd just like to echo Maggie's comments. Although the numbers are going down, we are seeing a lot of complex, very ill patients in the community that haven't actually reached the hospital, and they're really quite unwell indeed. So it's really important to still take this disease very seriously and make sure that you keep your space from people, wash your hands and wear masks when in contact with other people. But I am here to talk about vaccination. We've been vaccinating now for a little over a month. Our numbers on the island are included in with Hampshire, and we've vaccinated around 166,000 people. We have mainly obviously done most of that in primary care. Our hospital hub is doing frontline health workers and extended people as well that are involved with vaccinating and with people's care. So, for example, the voluntary sector. Primary care is vaccinating from 4 sites on the island, and that's Westridge, that is Carisbrooke, that is West White, and the Bay in Shanklin. We've done extremely well. We are following government guidance on which cohort to vaccinate. So we've obviously started with care home patients and staff. We're on track to complete that by the designated time that the government's asked us to. We're also vaccinating patients aged over 80, and then we will be moving on to the housebound that are aged over 80, and then those over 70, and also those that are considered clinically extremely vulnerable. I think what's really important, and it's a message that I'm sure we would all want to get out, is that the vaccine reduces your chances of getting serious illness. However, what we don't know that it might do is reduce transmission. So if you've been vaccinated, the vaccine doesn't kick in until about 3 weeks, but what's really important is that you carry on wearing masks, doing your hand hygiene, and keeping your distance, and not think that you've had the vaccine and that's okay. It might be that some people have noticed that there's been a slight change in age variations. So some neighbours might note that their neighbour next to them is 5 years younger and may have had the vaccine. The practices started at different times. Each practice has come together in groups, and actually each practice is given the same amount of vaccine. So some practices are very large and they may still be vaccinating their cohort, for example, aged over 85, whereas a smaller practice might have moved on to the next cohort. So what's really important is that people know that they will be contacted by the practices, and then when we get the new central hub up and running on the island, they will also be contacted via that hub as well. I think it's so important for us to say a huge thank you to our primary care colleagues, particularly the administrative side and the practice managers and the nurses who are actually doing the vaccinating. But this is taking a huge amount of preparation behind the scenes, often onto administrative staff. We often have to change at the last minute, no fault of our own, no fault of anybody. We're doing the largest vaccination programme ever done, and sometimes the vaccine is not available. We have to change everything at last minute. So that creates quite a lot of additional work, extra stress for everybody. So I think I know that you join me as well, Dave. I've heard you say many times before, a massive thank you to everything that people are doing out in the community with vaccination, and of course our hospital hub who are vaccinating our frontline staff, which is extremely important as well.
Well, you're absolutely right, Michelle. Firstly, I do want to thank through you all your team, and I call it a team again, out the front end, from the the receptionists right through to the doctors and everybody. This is what I like about the approach on the island, is we are trying to work more and more as a one public kind of service team, and I think this is probably a big message for us going forward. So yes, absolutely. I'm expecting the answer to be no, I can't do that, but are you able to give any kind of broad idea of how percentage wise even the vaccines are going on the island? Often people ask, they don't necessarily need to know exact numbers, but just perhaps some reassurance that and I know you've given the 4 sites, which is really good. Does it feel like the engine is moving? That's why I put it.
Definitely the engine is moving, Dave. I can't give any exact percentages, but I can reassure people that people on the island are definitely being vaccinated in time and at levels that we see in the mainland as well. So we're certainly not lagging behind because of the water or the island factor. If anything, we're doing better than surrounding areas.
Thank you for that. And I think there's been talk about the Riverside coming in to help as well. I don't know if you got the update on that.
The Riverside will be the central hub and will be centrally manned. Yes, the CCG are having involvement getting it set up. The details still be finalised. When they're actually finalised, I don't want to give incorrect data out on a public forum. We'll make sure that all that information comes out to our partners and also the public.
Thank you, Michelle. And I'm absolutely grateful for your, that input. Keep up the good work, and we really appreciate it. I'll apologise now to any members on the board, members on the call who've got access to things like the chat bar. I am restricting this to members of the board only because of the time, but also because that's how we've approached this, and we've got a constitution. So, but I'll relay in questions I see just to make sure we're clear on that. So that's really grateful. Any points of clarity from any board members, or can I let Michelle step back a bit?
Yeah. I think John wanted to make a point.
Yeah, John Metcalf.
Thank you, Chairman. I just wanted to, if I may, reinforce Michelle's point on data. I think we understand from talking to DHSC and the NHS that local authority level data is due to be produced in the next couple of weeks. So we will be able to tell a story as soon as that data is available. I think there's just the complexities of all the different places where people are getting vaccinated at the moment just means it all needs to be pulled together. So as soon as that data is available, we understand we'll be able to publish it.
Thank you, John. The other one was a really important point Michelle mentioned. She talked about how long the vaccine takes. Actually, even if people have passed that period, there's a perception from those that won't know if they've had the vaccine or not, that people walking around without masks and things and not doing it, are abusing things. I think there's a real message here, which is whether or not you've had the vaccine, please try and stay by the rules and guidance that is asked, social distance, masks when you need them, and keep everybody safe, because this is a long game. I appreciate as much as anybody that the vaccines are on the island and very active, but we're talking about a managed program for 140,000 people ultimately. And this is going to take months, and I think people shouldn't be under any illusion about that. And in the meanwhile, we absolutely need to keep our community safe. And I think I've sensed Claire up. So Claire is for the members of the public, Claire is our lead member for adult social care, public health, homelessness, and anything else I can manage to get her to do, and that's quite a lot. Did you want to come back?
Before Claire comes on, Dave, Claire comes on, can I just return your point? Even if you've had the vaccine, even if you've had the vaccine 3 weeks ago, you must continue to wear your mask. You must continue to wash your hands and do social distancing. We don't know yet whether the vaccine will stop transmission. And at the moment, it is not clear at all. So you may well be able to still be infectious despite having the vaccine.
And I'm grateful for that. And it's sometimes a misperception. We get it when we talk about ferries and things. It's even though people have to travel for legitimate reasons, they should still follow all the guidelines, because that's how you keep people safe. This is a killer. We know this is a killer, and we want as few people on the Isle of Wight to die from this as we possibly can have. And it's the work of people like Michelle and the others that are helping us there. Claire, I'll bring you in now if that's all right, because I sensed you want to add to what Claire and Michelle said. And thank you, Michelle.
Yeah, I actually know the answer to this, but I'm going to ask it anyway because I found it quite interesting and it should be in the public domain. So, Dr. Legg, if you have had COVID, how long after you have had COVID would you get the vaccination? If you were
1 month.
Thank you. I think there's lots of sort of stuff out there that people think once you've had COVID, you don't need to have the vaccination. And I think it's very important that people realise that they still need to have that.
Thanks, Councillor Mosdale. That's a really valid point. So if you have had COVID in the past, you should still have a vaccine. That is recommended advice. If you've had recent infection, as I say, you should wait 1 month, approximately.
Yeah. Thank you for that, Michelle. There's a lot of messages, and I'm speaking on behalf of the board, I'm sure, coming out to people about how they should act and perform to protect everybody from this horrible pandemic. As we know at the moment, nobody should be even travelling because they should be locked down. And I've had people say, oh, so and so, and well, obviously they can do it for work, etc. Simon B, Simon Bright, sorry, it's just called Simon B on my screen. Simon Bright, would you like to come in on that point?
I think it's, and I think Michelle made that point really clearly. I think for me, the vaccination is really our way out of this, but it's not our solution at this point in time. And we need to really be mindful that, people need to manage social distancing and carry on, because as Michelle said, the vaccine does provide long-term immunity and protect you from serious illness, but it doesn't prevent spread. And we just need to keep that. I'll just reiterate that point, and reiterating Maggie's point, absolutely agree. We need to kind of carry on that to protect our NHS so that people don't get seriously ill. And I was in my presentation, I was not giving the impression that we can relax, but I was just giving a little bit of hope that actually it's coming forward. Slowly we'll see that.
Simon, thank you very much for that. And I think members of the public will receive shortly, if they haven't already, some brochures and other information from us, because we are trying to use every means possible to reinforce these really important messages that I'm hearing from Simon, Michelle, Maggie. It's all, we're not just saying it for the sake of it. We genuinely want to keep people safe, and this is how we do it, and we know that. So thank you very much, Michelle. Really appreciate that. And now, if we're talking about safety, I suppose an opportune moment to go to, if I can get her on the call, which is Sarah Jackson, who's the head of our police on the island, and whose team of officers who, again, doing some amazing work, upsetting a few that need to be upset because they haven't stuck to the rules, but generally speaking, trying to help our community. Are you there, Sarah, and can you hear me is the first thing?
Yes, Leader, I'm here and I can hear you. Thank you very much, and good morning.
Thank you. Over to you.
I will pick up from where you left off, that actually the vast majority of people on the island are complying with the instructions, which, let's be frank, are very clear about stay at home in the first instance. There are reasons people can leave their homes, of course, and those are clearly outlined. Our approach throughout the pandemic has been to engage, explain and encourage people to comply. But we are a long way down that road now, and therefore we will reach to enforcement where there are blatant breaches, and indeed we've had to do that on the island, as you've alluded to, Leader, and we will continue to do that. The patterns we are seeing are people still gathering, whether that be indoors or outdoors, in breach of those rules. And in addition to that, we're working very closely with the council and the regulatory services teams in relation to businesses and issues that we're coming across there. So enforcement is happening across agencies. Clearly, we would far rather people can be encouraged to comply, but the most important thing, as has been highlighted throughout, is that we aren't complacent as a community, and that we take our own personal responsibility to comply with the regulations and the guidance, which means then we in policing won't have to resort to enforcement, but we absolutely will when the cases warrant that action.
Thank you, Sarah. That is a really clear message, and I think I'm really pleased that we can echo that out. And I again want to thank your staff, who are actually putting themselves totally on offer when they deal with some of these incidents that I know they have on the island, and we should appreciate that they're prepared to do that. And I just would ask the public, and the vast majority will say, well, I'm already doing this, is just to stick by the rules and let's get out of this together in a safe way. But to know that we've got the backing fully of our police officers is brilliant. So thank you very much, Sarah, for that. And if there's any clarification points for Sarah, I haven't seen anything on the chat line, so I'm going to move now to the voluntary sector. And I think I don't think Emma's here, but I think, unless I'm wrong, I apologise, it's either Emma or Michael. I'm not sure which. Michael, shall I call you?
Hi there. Sorry, I'm. Thank you, Chair. I'm not sure if Emma.
Yeah,
Emma
I am.
is here.
Yeah.
Oh,
okay. Well, Michael, if you start, and then if you're
first.
brief, I can go to Emma. Is that all right?
Okay. Shall I do that, Emma? I'll start, right, and then over to you. Just wish to really highlight some points in the voluntary sector. As people have said, and you've acknowledged, Chair, the voluntary sector has really come up to the table yet again in a big responsive way. Some highlights on this. There are over now 50 plus drivers that are safely set up with all things like DBS and screens in cars, etc., under the Optimo voluntary driver scheme to now act as a really last resort where people can't get to vaccination centres. Through the GPs, they can contact that service, and that's been set up very, very quickly. And the team, so particularly someone called Kay Smith, has worked endlessly to get that off the ground. You've now got volunteers helping at all the vaccination hubs, and they've had to be very versatile, because obviously it all depends when the vaccinations arrive, but they have done, and I think a huge thank you needs to go out to those volunteers. The 26 community volunteer hubs that have actually been there right from the beginning of the first lockdown are still very much there and responding to things like getting food to people, getting support. There's quite a network of telephone support for people. There has been a report, obviously, of increase of help, but that has been responded, and an increased number of people who are volunteering. Obviously, when lockdown came out, a lot of people who furloughed had to go back to work, who are now furloughed again, who are actually sort of responding. You've actually got, I think, some of the major voluntary sector organisations, Barnardo's, Community Action, Isle of Wight Youth Trust, Age UK, People's Matters, Isle of Wight Carers, are all reporting high increase of people coming to them. But I think what is amazing is that they are keeping services going through this difficult time, and have had the same issues, I think, of everyone, of staff being sick, and also volunteers within that. So within that, there's a particular, just wanted to highlight a particular issues that raised a recent voluntary sector forum meeting. One was a lot of groups, for instance, I use the example of the Isle of Wight Prostate Cancer Group. They have very much in the past been very face-to-face, and that is needed. And so they've had some difficulties that some people have responded to Zoom meetings, right? But there are people in the community that haven't, and I think there is a legacy, which I think we've talked about, of other health groups that actually going to need quite a lot of support through that. And the other one was through carers and the cared for. Many of the cared for, in a sense, are getting vaccinations, but often the carer who's probably also got needs, it's just that they're probably fitter than the person they're caring for, have raised issues about obviously vaccinations, and I just sort of, I think, just feed that into other partners. And lastly, on a positive note, the Susie Sheldon, the Lord Lieutenant, and Independent Arts have launched Look Out of Lockdown. There is a Look Out a Lockdown website. The media are very much involved, and there's already been an incredible response. This is people bringing in positive poems, pictures of their garden that they've done through lockdown, all imaginative, creative ways on the island. It is really taking off, and I would just really promote it, that it does give hope. And I think we need hope at this time. Thank you. And over to Emma to fill in the gaps.
Yeah, Michael, just before you go, thank you for that. And I do appreciate some key points. I've just written down as you were talking, the island's voluntary army, because the numbers are immense, and the jobs they're doing are so diverse. that I think we should see them as the Isle of Wight's voluntary army, and they're doing a fantastic job. So please feed that back to your contact.
I will do. All right,
and
thank
a
you.
note I put for Sue Sheldon is to make sure we include her in our mental health strategy going forward, because I think you're right, the Lookout Lockdown, which Susie's fronting as the lead, is really, really good. And I think it's those kind of innovative things we shouldn't lose sight of. So thank you for mentioning both of those. Emma, I'm over to you now. Can you just introduce yourself a bit for those that don't know you?
Yes, absolutely. Good morning, everybody. I'm Emma Lincoln. I work for Age UK as the Age Friendly Island Project Manager and currently on a secondment as well to Isle of Wight Council. So just really to continue from what Michael has said, really, Age UK are continuing to support the response phase and statutory sector in this work as a united front. Like many others, we are experiencing staffing issues. We have a depleted exec team at the moment due to some long-term leave of absence. Definitely noticing the fatigue of staff and anxieties amongst staff is becoming a problem. We've experienced a staff member dying recently from COVID. So like everybody, they're definitely noticing those strains and pressures. Regards to the services from Age UK, our Home Safe service, which has our handy person service, we're looking to hopefully resume that with some outdoor work only. Our Just About You service, we have a reduced service on offer for that at the moment with meal preparations and shopping. However, we are looking to on a client by client basis, we are contacting them from 25th of January to see if there's further help, such as domestic help cleaning, that they would to resume. But obviously that we have to take serious considerations on the safety of people and our staff on that one. We've had some very good meetings with our Living Well team, who can better support adult social care and other integration activity. Making a difference through COVID has been the integrated hospital discharge team and referrals from EULA. Our information and advice team are definitely noticing an influx of calls, especially around mental health, loneliness and isolation, which is of no surprise. And these are including suicide and domestic abuse calls as well. And finally, we are on a recruitment drive really at the moment for an increase of volunteers. We've lost a number of volunteers in the sense that they are either shielding or isolating or have COVID. So yes, that is something else. We have some processing going on at the moment with volunteers. And just to say, with regards to the whole sort of digital divide, we have noticed amongst our older community, we are actually in the process of launching a survey, a digital survey out within the community, which will take place from the 1st of February. And that's a survey that will be online or via telephone to look at how people can better be supported to be digitally connected. I hope that's everything from Age UK.
Emma, thank you very much. And again, to the voluntary sector, I know Michael will take the message, but please from yourself, can you pass on that you are part of the island response team here?
Thank you.
I'll pick that up. Sorry, I was just reading something as we go through. So thank you for that. I finally want to go to Healthwatch. I'm not sure, I've written down Jill, but I'm not sure if Jill's on the call or if we have a representative from Healthwatch.
Chairman, it doesn't look like Jill's on the call.
Okay, I'm mindful that Healthwatch play a part. Just want to recognise that as well. So thank you. Unless there's any other member whose update I've missed, please speak now because I won't want to miss it. I think that's the members' updates. And then I think the only other thing I'd like to do is just invite members. If there's any other points I want to make about our COVID response. I'm going to make 2 points just for the record at the moment. The first is the Isle of Wight Council, in particular the Cabinet team, have been considering something that the Prime Minister mentioned, which is in due course how are we going to have some form of service of commemoration for those that have been lost during COVID? And I know there are many families on the Isle of Wight who have had to go through what is probably the worst, not just the COVID actually, people who have lost family but haven't even been able to have a normal funeral or even grieve in the way they want. So there's something that we are mindful of. And there's also some outstanding achievements going on, almost unbelievable, people stepping up, unsung heroes. So we are very mindful of that as well. Those are 2 points that I am crucially aware of when the time is right. So that is that. So now just invite any general points. If you can show by just commenting in the chat, but I've seen Maggie, so I'll go to Maggie straight away. And then if anybody else wants to speak, just put speak please in the chat box and I can pick it up. So Maggie, over to you.
Yeah, thanks, David. I just really want to come back on that point about recovery and how we support people at the end of this. I know my report, when I updated earlier, I'm very focused on the now because the pressures my own organisation are under are the now. I would also like to stress, though, that we are thinking and talking internally around how are we going to support both our staff and the community when we move into that right next phase. So I think it's really should be a key priority of this board. I also suggest that through the ICP that we see what the ICP's views are about collectively. We, myself, John and Alison, Michelle, people like us, we talk about us and our, and we mean collectively across our system, health and social care in its most broadest sense. And I think we have to recognise, and we do recognise that whilst we've seen an impact on our community, that means our staff as well. So many of my staff, you know, we're caring for our own. So it's a double whammy impact. We're seeing people who are going to be on a professional level very fatigued and very much in need of our support psychologically to recover. But those people are also members of our community who will have lost loved ones, family members and friends. So through the ICP, we will be looking at what our collective response should be. And I think we can update this board in due time. So I just really probably want to give some reassurance that whilst I'm in the eye of the storm, we are also trying to look at what our total offer should and could be when we get to that point. Thanks, Dave.
Thank you, Maggie. There's something you said actually imparting to me on one of our previous meetings, and I hope the public will think about this. This is an island, and as islanders know, the reality of life is we all know each other. And when our nurses and doctors are treating people in hospital, quite often they're treating people they know or people they know the family of, and it becomes very personal. And they absolutely, it motivates them very highly. And I just think that really has hit home to me that we're not just treating people, we're treating island people in particular, our families, our friends, people that we really wouldn't want to be in the place they are. So I thought that was really pertinent. And the reason I mention that is because the other thing you've said, and I think I agree totally, we need to look at how we support our staff as we come out of this, because and lots of other people will have gone through trauma they would never have expected to go through. And they don't have a book on COVID management that I'm aware of. They might be writing it, but they haven't got it at the moment. So I think I'll note that as an action as well, and it fits into that kind of wider mental health picture of health and well-being, which is what we're about, Maggie. So let's commit now that we're going to take that on as a project going forward, so that we can help people through the as you know, what sort of a post-traumatic stress disorder, which people shouldn't be embarrassed to talk about it, because we all know somebody that is feeling this, even if it's not ourselves. So really good. Thank you very much, Maggie. I'm a little bit worried, Michael, I may have missed a question to Sarah Jackson. If I have, I apologise. And is it something you want to raise now? Can I ask Sarah to contact you? That's Michael.
Just ask Sarah to contact me,
Okay.
but I'd like to speak in relation to this section. Thank you.
Okay, Michael, your floor's yours.
Oh, okay. Thank you, Chair. I totally reiterate your points and also Maggie's points. I just want to add to that very briefly. I think the the staff, absolutely, and post-traumatic staff, and I think key workers have been affected right through. So even, for instance, at Rye Town Council, there are staff that had COVID. There are people who have lost loved ones. It's affected right across everywhere, and we're expecting those people to be part of building the recovery. So we do need to give them TLC and support, because, as you say, post-traumatic stress, which is what I worked in for nearly 40 years, is if you haven't got the team, the people talking to the people really supported, then how can they do that? So I think it's very important.
Thank you.
I do want to raise, just on the memorial side, originally there was a sort of meeting that was led by Susie Sheldon that was looking at that. That's how the look out for lockdown came, because we actually said it was too early, and actually we needed hope, a message of hope. So it sort of moved to that. But there has been, it's worth talking to Susie Sheldon, because she, one, was looking at the honours of supporting people, and obviously she's linked to the Queen, and secondly, looking at places around the island that could be memorial gardens and things, and that is in your recovery plan. I mean, it has been highlighted by Chris Ashman within that, and I think we've got to have those places around the town so people could go to, because we've actually got people who are losing loved ones who actually can't even get to the funeral, right? They are literally have no way of grieving in the normal way. And I think it's important to talk to the Archdeacon and all the faith communities, because they are really hitting with that. I mean, someone called Samantha Martell, who's a vicar in Ryde, talks about actually doing a number of funerals where she's the only person there, right? And the family sort of thing. And the last point was just about the town and parish councils, who are all now setting their budgets for next year and their plans for next year. They are dealing with the now, but they're also thinking about recovery in their communities. And I know that someone from the town and parish council is not here today, but I think that that's perhaps important to be on a future agenda within that. But those are my points. Thank you.
Michael, thank you very much for that. I'll do 2 points. On the memorial side, you're absolutely right, Susie Sheldon, a natural contact point on this. I've already had conversations with the chairman of the council as well, because I think the council has a very clear role here. I think town and parish councils have a clear role. I like the idea of memorial gardens, or some form of recognition that people can reflect back on. That's one of the things we perhaps are good at thinking about in this country. And I also made a note, faith communities, but of course also I'll think about those people that don't follow any particular faith, who
absolutely,
have also grieved. I saw, thank you, Michael. I saw Jill Kennett has arrived onto the call. Jill, I just wanted to give you, if you are there, the opportunity to speak about actually Healthwatch, but also, as I know you chair the community hubs, if there's anything you wanted to bring to the attention of the Health and Wellbeing Board and through the board to the public. I'm hoping she's on the call, because I've got a...
Sorry, Chairman, I still
That's all right.
She's on the call.
Is she there or not?
No.
Okay. I thought I saw in the box that she said she was on the call, but not to worry. Claire, you're in my line of sight, literally.
I think the chief executive was before me, so I'm going to.
Okay, we'll go CX and then we'll go Claire.
Thank you, Councillor Mosdell. Thank you, Chairman.
Cool.
Chairman, I just wanted to kind of bring us back to the wellbeing part of the title of the board, if you like, because I think Maggie Eldon from the hospital hit the nail on the head. You know, at the moment we are in the eye of the storm, and I think we're collectively in the eye of the storm. And I just wanted to describe how I see things, if you like, over the next 12 months, because I think it's relevant to the board's considerations. So at the moment we are responding, and we are, you know, obviously trying to drive down the number of cases of COVID on the island. we're supporting the hospital in terms of numbers going into hospital, and that everyone's doing a fantastic job in terms of trying to keep people as well as possible given those particular circumstances. We know at some point, and the Prime Minister alluded to it last night, somewhere around about or after the 8th of March, we're going to come out of lockdown. And I think there are two things for us to think about at that point. It's how do we respond as we come out of lockdown, first in terms of our own personal behaviours, but secondly in terms of our organisational behaviours, to help people start some recovery, but at the same time we've got that responsibility to make sure that we still continue to control the spread of the virus, because we know the next deadline, if you like, is going to be around about early summer, where hopefully the majority of people are going to be vaccinated. But even then, we've still got how do we control things, and at the same time, how are we controlling, and also supporting individuals to recover their health and well-being in a number of ways. And I'm grateful for everyone's comments about mental health and well-being, but I'm sure that our colleagues from the hospital and the CCG would also talk about all those people who've missed surgeries or who've needed to go back for appointments. And you're looking at all the data, that's going to be a massive draw on our NHS colleagues, where they've already just been through this massive draw on their effort and attention. So I think at some point over the course of our next couple of meetings, it would just be worth reflecting on that and thinking about how we collectively work as a system to deliver on some of those things, whilst our longer term aspiration is going to be the longer term health and well-being, and trying to deal with some of the bits that everybody's missed out on. So just in terms of shaping a future debate, I think that's important to just get that out on the table, I think, and perhaps think about how we look at that at a future meeting.
Yeah, I called it the long-term recovery plan because it isn't going to take 5 minutes. You're absolutely right, John. I think it's a topic which has many tentacles, but I think you're right. We should have it at the heart of the Health and Wellbeing Board's agenda going forward. So I've made a note of that, and that's on the record. I've got Claire, and then I think I've got Paul Brading. So Claire Mosdell and Paul Brading.
Yeah, my point is for two things, and Maggie Oldham agreed with me yesterday at ICP that we should make sure that we remember to expand our thanks and how we're looking at the rest of the community who's working in what we think is the eye of the storm. So within the independent sector, which is our care homes and ancillary cares, I gave an example of my daughter extending her shift, where she'd already been at work at 6 o'clock in the morning on Saturday, but didn't finish until late because she was sat with an elderly lady who was passing away, and she wanted to make sure the family were contacted by herself and stayed there with them. So there are lots of people who are doing lots of stuff outside the hospital environment as well, and I think we need to recognise that, especially when we go to our recovery plan, because those people are also incredibly tired and broken from they've seen that they wouldn't normally, and those domiciliary care agencies who are keeping people safe within their own homes. I think when we talk about memorial as well, we need to ensure that we don't make this COVID specific. I'll give an example. I lost my amazing friend who was a parish councillor of lung cancer, who basically had a cough in February and she passed away recently. She would have had the type of funeral where she did so much for the community that would have been the type of funeral that would have been 500 odd people there, and we did line the streets through Newchurch, all socially distanced, but it was very sad that she couldn't have the level of respect at that funeral that she would have had. So I think when we come to speak of memorials, we need to talk about all the people that have passed away during this period, because it's just as hard for someone if they pass away of cancer as if they pass away of COVID. Passing away is passing away, and I think we need to make sure that everybody is taken into account at the end of this. Thank you.
Thank you, Claire. Paul?
Yes, thank you, Leader. Just a couple of points, actually. Councillor Liddy made a good point about town and parish councils, and their involvement in the community hubs and their involvement in the recovery of the island. Disappointing that I don't think any IWOC representative is on this meeting today. But equally, I think we need to involve HALC in this as well, because now at least 30% of the Isle of Wight councils are now member of Hampshire, the HALC. So I think it's important that those two bodies are made to feel important part of this board, because it's part of our recovery strategy. But second point, the more important point, I suppose, is that I agree with what everyone said about praising everyone who's working phenomenally hard on the island, from everyone on this call to the community voluntary hubs. But I think that for me, I I think I'd like to thank you and Maggie. I listen to Isle of Wight Radio, and the broadcasts and the messages, the clarity and sincerity of the message that you and Maggie give out on the radio is really, really encouraging. I mean, yeah, I know a bit more being a cabinet member, perhaps than a member of the public, but I was a member of the public. To hear yourself and Maggie on the radio last week with that real sincerity and clarity of message, I think was brilliant for the Isle of Wight. So thank you to both of you for your, you're taking the time to do those difficult radio interviews at difficult times. So it gives that reassurance to the public that we are doing things right and working together as an island, we can come out of this really well. So thank you.
Thank you, Paul. Funny enough, it feels quite easy because I've got family members who are teachers, family members I've got grandchildren. I feel like I'm trying to do my bit to help, our community's future. So it feels a bit, and I have to say, and I'll go extend it, I would thank Isle of Wight Radio, Vectis Radio, Isle of Wight County Press, the Observer, all of our media, and I'm sure I missed somebody, Vectis Radio, all of our media who have actually stepped up to the plate when we've asked.
Yeah.
And have actually tried to get these messages out because there are so many different people we've got to reach. And I just ask everybody, go back to what Maggie said, we're in the eye of the storm. This is not over. Now is the time to really get a grip, do what we should, and we can all look forward to a summer then when we've actually got ourselves through the worst of this, and then we can have a reformed, if like the new normal. So, Paul, I thank you very much for that, but I also use it as an opportunity to re-emphasise let's work hard to get through this, and then there'll probably be a time for lessons learned as well.
Absolutely.
Simon, I see you looking at me. I don't know if that's because you'll put your screen on or you want to ask a question or make a comment. I wasn't sure.
I put it in I put something in the chat just to say, could I speak if that's okay?
Yeah, absolutely.
Really, I think those comments are really well made, and I think just to pick up on the Chief Executive's point, we're working really well as a system in this emergency, and we're using all the emergency planning structures, and it's absolutely right that this board has oversight of health and wellbeing as presented by all the data and discussion. And I think it's how we then move forward. We need to refresh our health and wellbeing strategy in light of this, in light of the new data that we're finding, so that we can move forward and take on all the change that we have seen in terms of the way health services are provided, or the way that the population health has been impacted by COVID, and think about how we really drive that forward. I'm not sure we've quite got the headspace to do it now, but I think over the next few months, as this part of the emergency eases, we do that. And I'm thinking particularly on what others have said, should our strategy really think about our approach to helping people die well as we've got starting well, living well, aging well. Well, it's a key part that we've all been really hit by, and how do we build that into our long-term strategy? So I don't say this board really needs to do that, but we're in the eye of the storm and working well together, and this board will be working well together for more years, but in a slightly different way out of COVID.
Simon, I think that's a very it's a very honest statement, and it's something that probably if Nigel Hartley from the Mountbatten was listening now, he would absolutely echo, because he and his setup is dealing with a lot of people that unfortunately have to take that point. I think that's a really, really honest and open statement to make, and it shows, I think, for me, that this health and wellbeing board, if it's going to be truly valued by the island, needs to take on these responsibilities. So thank you. I've got a question for our chief exec, which is whether we need to deal with it now or not. It's just, are we going to use this format at the next meeting, or will we in a slightly different place? Because I'd like to let the public know, because it's very informative, this actually today.
I think, Chairman, I'll be guided. We're guided by you and guided by the position that we find ourselves in terms of responding to the pandemic. Clearly, nobody was really able to prepare reports for today because everyone's got to focus in a slightly different way. But I think we're starting to create an agenda for the next meeting from today's debate, which I think we can develop.
Thank you. I agree with you totally. Last item on the agenda, I think, is members' questions. And I take that to be members of the board. Are there any other questions that members of the board have got? Seeing any? Sorry, Michael Lilly, apologies.
Thank you, Chair. I did put it in the catch line, and I think Claire has helped with it. It was really to get clarification on the vaccinations in care homes, which is obviously very important. I was astounded. It was reported to me yesterday through the voluntary sector forum that actually all care homes on the island had actually received vaccinations or were just about to, including their staff. Definitely, I've got feedbacks of all the care homes I know in Ryde. I have 3 in my ward, and they have received the vaccinations which were administered by the CCG. And
okay,
I just
Michael,
wanted to confirm that and then just congratulate everyone if that's the case.
Yeah, Michael, so 2 things. I should have made myself clear. This is any members' questions that were notified to us, which I don't think.
Oh, okay, I apologise.
But no, but in fairness, I think Claire will probably be able to give a response, and then I'll probably move to close the meeting. Claire, can I leave that with you to respond?
Yeah, of course. I wouldn't like to put that data out because, as I've said, my question to Dr. Legg, if someone has had COVID, then they can't be vaccinated, and we wouldn't like to put into a public domain information and because you can't actually vaccinate everybody at the moment. But what I can say when it comes to care homes and the Dom Care Agency, our commissioning team within adult social care have rung for the last 9 months every single care home every single week. And they've also had the same person within the team ringing those care homes. So that the data that I have through every single week is on where they have PPE, now what's going on about vaccinations, what their staff levels are, what their vacancies are. And that has become amazing because we now have a relationship within the adult social care teams within the Isle of Wight Council with those independent care homes, and we can pick up things really, really quickly. So when we come to the end of this, I'm sure we will be able to produce some nice graphs and pictures out of it, but the assurance needs to be that with the support, I think, from adult social care and vice versa, going backwards and forwards, has been absolutely exceptional. I would bring Simon Holmes in, but I know you want to bring the meeting to a close, and I can see Michelle's smiley face there.
Yeah, I was just going to check with Michelle because she heard what both Michael said and you said. Is there anything you wanted to add? I didn't want her not to have that opportunity. You're okay with that?
Thank you, Dave. I just would like to agree with what Councillor Musdale said and Councillor Lilly. We have endeavoured to do all homes. Unfortunately, some homes have had outbreaks, and we are now waiting for that month that I spoke about earlier before we go back in. But we will be going back in, and we are on target.
Thank you, Michelle. And I think just to close, our comments of positivity extend to all care homes, both the independent and the council-led, etc. So just trying to include everybody. Okay, I'm going to call the meeting to a close there. It's 10:59. I thank everybody for their participation and their inclusion. And our next meeting agenda will come out in due course, as described by the Chief Exec, and he and I will work that up with our members. So thank you, and I call the meeting to a close now.